My name is Dr. Hannah Wellman, and I'm with Rood & Riddle Equine Hospital in the ambulatory department doing farm calls for sport horses. And today we're going to be talking about flexion tests. This is Winston who's going to help me out, and we're going to show you what we do. We're here at the Kentucky Humane Center doing these evaluations for our flexion video today. And it's an important consideration that at this facility all horses that are donated undergo a thorough physical examination and a full soundness evaluation, which includes flexion tests that we're doing today. And if we find a horse that is lame, all of these horses will go on to have further diagnostics so we can determine the cause of lameness and their adoptability. A flexion test is usually used as part of a lameness evaluation or in a pre-purchase type situation, and it involves flexion usually of a joint structure to create strain over the joint capsule and bony structures of that area to see if we can exacerbate any underlying disease or injury that's occurring there, like arthritis. The joint flexion is usually held for a period of time, which varies between veterinary practitioner, but it's usually between 30 seconds to a minute. After the flexion is held, then the horse is usually trotted off and evaluated. With this horse, we evaluated his lameness and flexed his fetlock, and he was lame in the left front limb. The major limitation with the flexion test is that it's not specific for an anatomical site on the horse. Even though you may be doing a fetlock flexion, for example, you are putting strain not only on the fetlock joint capsule and bones in that joint, but also the coffin joint or the proximal suspensory, as you flex the fetlock, you're also pushing the proximal suspensory into the back of the knee. So we have to consider this while we're doing these procedures, that you are affecting other joints and you're not specifically localizing one site on that limb. And so we take that into consideration along with a thorough physical examination and the history that's presented by the owner or trainer into evaluating that horse's soundness and lameness and making a diagnostic plan to investigate it further based on those findings. Another limitation or consideration for a flexion test is personal veterinary preference. It's something that you gain kind of with experience and how you interpret it. Of course, you're placing a strain over a joint, and that strain can vary from one veterinarian to another. And so you start to develop a consistent pattern that you can interpret. So for an older horse, for example, if you place excessive strain over a joint that may have arthritic changes in it or anything, you're going to probably create a positive response in that horse. What you have to consider is the significance of this response based on your physical examination, the history, and your evaluation of soundness before you place that strain. So that's why it's really important to do a flexion test in combination with a lot of, a full evaluation of the horse instead of as an isolated diagnostic.